Hello friends, welcome to Medicine 101. Today I am starting the new series of the lectures from the general surgery aspects. Okay, so first I'm uploading the videos based on the thyroid. So it's very easy to understand that it's the very familiar knowledge for us. So whatever the anatomy and physiology things are over here. Yet I'm just saying once the thyroid. Okay, so if we just say that for the normal weight of the thyroid, it will be how much? From 20 to 25 gram. Now, what's the main functions of the thyroid? That it acts as the storage of the iodine. More than it's about 90% of the body's total iodine that is getting stored within the thyroid gland. Now, the daily requirement of the thyroid that is from 100 to 150 microgram per day. We need it. Okay. Now, whatever the thing. Now, let's suppose if I just say that someone is having the goiter. Why we know the deficiency of the iodine? Because as a result, we will see that there will be the swelling of the thyroid gland definitely. So we know that is known as the goiter. Now what is the relationship in between the thyroid weight of the thyroid gland and iodine intake? So is the inverse relationship. We say the weight of the thyroid gland that is inversely proportionate to the the iodine intake. Now that means if someone takes the less iodine, so definitely the weight of the thyroid gland will be more. So as a result, we can see these things. The patients or the individuals, those who take the less iodine, there is the chances for them to getting the goiter more. Okay, because the weight will be more over here. Now we'll talk about some symptom, some disease that comes over in the exams. Okay, so first things we just talk about in terms of the Wolff-Chakoff effect. Okay, Wolff-Chakoff effect. This means that whenever we'll see that hypothyroidism. Okay, if we see the hypothyroidism, that is for the iodine. So if we see the iodine-induced hypothyroidism, that is known as Wolff-Chakoff effect. In the opposite things, if we just see in the in the George-Basedow's effect, what can we see over here? That will be the iodine induced hyperthyroidism. Okay, now if we just see that normally that what type of the positions of the thyroid gland, we know that it's the anterior of the trachea. Now if we just see that normally this is the thyroid gland, this is the two lobes, this is the isthmus part. Okay, now this is the trachea. And if we just see that isthmus is directly connected, the main part of the tracheal cartilage, that is number 3. So basically if we just see second, third and fourth cartilage is getting connected with the isthmus, but mainly the third cartilage is over here, that will be connected with the isthmus of the thyroid gland over here. Okay, now the another what is I just already said about the Wolff-Chakoff effect, where we will see the iodine induced hypothyroidism. In the next one, if we just see in terms of the George-Basedow's the effect, where we will see the iodine induced hyperthyroidism. Now another thing that is important, that is the Penroid Syndrome. What is Penroid Syndrome? If you see the mutations in the chromosome number 7 in the long arm, or in the Q7Q, we can say, then we can see that one type of the problem where we will see the Penroid Syndrome is the combination of the two types of the things over here. Okay, we will see the congenital sensory hearing loss, so auditory problems over here, along with the goiter will be also over there. Okay, that's the thing over here. Now if we just see from the complications as far as the surgery is concerned, so let's talk about the thyroglossal cyst. It's one of the important thing over here. Now thyroglossal, from the term, it's very easy to understand that there should be some connections in between the thyroid gland and the tongue. Glossal muscles are in the tongue, we know it over here. Okay, now if we see the link in between the thyroid gland and the tongue, within the tongue, if we just see this portion, that is known as the foramen caecum, uvula. Okay, now there in between them there is a bone that is known as the hyoid bone. Okay, that is the hyoid bone. Now the most chances, or the most common portions to getting affected, or the formations of the yeast, the chances is more over where? In the subhyoid regions. Here the chances for the cyst formation is the maximum. Okay, now the other locations are also as well over here. So we can say over in terms of the suprahyoid, the near the thyroid cartilage. Okay, or we can say the floor of the mouth, or along with that near the foramen caecum over here. So that the chances also to have the thyroglossal cyst, but the most chances, or the most common one, that is the subhyoid over here. Okay, now what type of the clinical manifestations we will get in these patients? The most times of the clinical manifestations we will get that the midline swelling in the anterior part of the neck. In these regions we will see the swelling. Okay, in these regions, so we will get the midline swelling in the anterior part of the neck, and whenever it will just during the protrusions, it will move upward. Okay, now what about its other complications? These are the clinical manifestations. Now whatever the complications we can have in these patients, those who are having the thyroglossal cyst. Now in this case, if we just see in terms of the complications, so definitely whenever we are doing this type of this type of the things, so definitely there is a chances for the what infections. Now if we see the development of the infections, then there is a chances for having the abscess, and whenever there is abscess, now we can just do the IND for it, but the bad effect of it that can lead to the thyroglossal fistula. Okay, so it's not should not be done. So you can write it over here. Shouldn't be done. So otherwise it will lead to the formation of the thyroglossal fistula. So the another complications for it over here, we can say that if the the thyroglossal cyst long lasting, that can cause the papillary carcinoma, that can cause to the papillary carcinoma over here. Okay, that's the main problem over here. Now what about the treatment? If we talk in terms of the treatment, what can we do in these cases? Now in these cases we can do that on type of the cyst trunk operations. In the cyst trunk operation, what do you know about these things? In the cyst trunk operations, we will see that these portions should be eliminated from here as a single piece. Along with that, some central portions of the hyoid bone also should be also eliminated. Okay, in the treatment of the cyst trunk operations. So this is the treatment for the thyroglossal cyst. Other types of the also problem you can see over here, the from nomenclature, that is Refetov syndrome. In these cases, we will see the end organ resistance to the T4. In the organs levels, we will see the resistance for the tetrahydrothyronine. Okay. Now we can also see the endemic goiter, where, for example, in a population, those who are having a problem in terms of the goiter, if we see more than 5% of the populations are affecting over here, that will be regarded as the endemic goiter. Another one is the retroesternal or substernal or medial sternal goiter, where we will see the 50%. Okay, of the thyroid tissue, we see the 50% of the thyroid tissue that will locate below the below the thoracic cage. In these cases, we will see that the retroesternal or substernal or medial sternal, the same name. Okay, the same thing for the different names. So here we see the 50% of the thyroid tissue that will be located below the thoracic cage in these cases. Okay, so this was the first part of the general surgery as far as the thyroid is concerned. In the subsequent part, we will talk about the most other conditions where we need the surgery. So thanks for watching, and if you just like the videos, don't forget to subscribe and please comment sections. And I just said whatever I have as much as I can, but if you have any questions regarding this topic, let me know in the comment sections. I'll be there to help you guys. Thank you for watching.